Good morning, everybody, and welcome to the YouTube channel. Sorry, trying to adjust after taking off your glasses is kind of a nightmare. So this is going to kind of focus the topic of a mental disorder that I was diagnosed with a few days ago, on the 4th. It is called Central Auditory Processing Disorder. Now, my doctor described it to me as dyslexia, but for sound. So I can't hear sound right, if that makes sense. This is kind of like the diagnosis paper, so just so I could figure out what it was actually called. Yeah, abnormal processing perception and central auditory processing disorder is what it's called. It is most prominent in kids. It is not usually prominent in adults, but I was having hearing problems. I thought it stemmed from a trauma that I had done to this ear when I was younger. But it turns out, no. Whole's fine. Hearing is great. Like, physical hearing is fine. My hair is all over the place. I just brushed it, and it's, like, everywhere. But my eardrum is fine. My actual hearing is fine. I tested normal and all of that, but I still don't hear well. So, and I did get tested at an ENT, so I went to an actual ear doctor to get tested. I have a page pulled up on my computer right behind, so you'll probably see that glare. That's why I actually took off my glasses, is because the glare is pretty bad. But because you can kind of see a reflection in my glasses. But, so this page that I'm looking at, I'm just looking at very basic, Google. That's what it is, Google. So, let's see. So, this definition here is a disorder affecting the ability to understand speech. There's no known definite cause of auditory processing disorder. It may be linked to ear infections, premature birth, or head trauma. Now, the head trauma part is more than likely what caused mine. When I was younger, my step siblings were not the nicest, so I used to get dropped on my head a lot. I used to have things thrown at my head. I've had things as hard as footballs intentionally thrown at my head to as light as, like, I've had shoes. They've thrown shoes at me before, too. So, for me, I'm pretty sure it's head trauma. So, the symptoms as listed on here, I'm going to go into a little more in depth of it. But the symptoms listed are difficulty understanding speech, which is really in noisy environments. It can happen for me even in quiet environments. I struggle to understand sound. Following directions. This was most notable when I was trying to learn to drive. My husband would tell me to brake. I would accelerate because I didn't understand the directions. And distinguishing between similar sounds. So I will not be I can't tell a bird from a cat. That makes sense. There's no treatments. There's things to kind of alleviate it, make it a bit better, but there's no way to actually treat it. You have to see a specialist, which for me, a specialist is not an option because in my state there's only one specialist and she only focuses on kids because typically this happens in childhood, and she does not accept insurance, so it's hundreds of dollars even if she did accept an adult. But a more in-depth view of it, and this is coming from the American Speech, Language, and Hearing Association. So this is an accredited association. So there are signs and symptoms of CAPD. I'm going to go ahead and list them because people may have it and just don't realize it. Because some of these symptoms, it kind of also is associated with ADD. So you could think you have ADD, but you may have this instead. If you've had trauma or anything to your head. Difficulty localizing sound. Difficulty understanding spoken language and competing messages. in noisy backgrounds, in reverberant environments, or when presented rapidly. Taking longer to respond in oral communication situations, which is me. I will sit there and pause for like a minute or two when someone's talking to me. And then they'll start trying to talk to me again, and then I'll process late what they said, basically. Frequent requests for repetition, saying what and huh frequently. I do that a lot. Inconsistent or inappropriate responding. I also do that a lot. Somebody will ask me a question, I'll respond like it was a whole different question. Difficulty comprehending and following rapid speech. This was me at work. I could not follow my doctor when I was working in the medical field. I could not follow what he was telling me. He would speak very rapidly, and I couldn't process it. Difficulty following complex auditory directions or commands. This I noticed prevalent when I was in retail. I was a manager, so I was in charge of setting up all the displays for like holidays and stuff. And I couldn't remember anything they told me, like right after they told me. Difficulty learning songs or nursery rhymes. I don't have this issue. Songs are easy. I could never repeat it back, but I can learn it for myself. Misunderstanding messages, such as detecting prosody changes that help to interpret sarcasm or jokes. I don't have a sense of humor. I really, really don't, because I don't often hear it. Poor musical and singing skills. Musical, yes, I tried to play the flute and failed. Singing, yes, so I'm probably pretty bad at it, I don't really know. Difficulty paying. This is where we start moving into some of those ADD, similar symptoms. Difficulty paying attention is an ADHD and ADD symptom as well, and being easily distracted is also a symptom of those two. So if those are like your main two symptoms, I would look maybe into your ears. Poor performance on speech and language or psychoeducational tests in the areas of auditory related skills. When I was taking a psychology class, he would do a lot of auditory stuff with us, and it didn't work with me because I couldn't, I guess I couldn't process it. Associated reading, spelling, and learning problems. This is very much true. I cannot read and understand text. Like, I cannot comprehend and repeat it to somebody, like, at all. And it's really prevalent a lot in my nursing education, because I have to read these textbooks and try to repeat that information. I can't. Spelling I'm fine with. I'm totally fine with spelling. Learning problems, so math is kind of difficult. I have to always keep visual charts that I can follow, and then I can redo that. Difficulty learning a new language. I've never actually tried. Yes I did. I tried Spanish. And I tried French at one point. Yeah, no, couldn't do it. Tried, couldn't do it. So those are my main ones. So like language is my main one. Localizing sound, paying attention, distracted, and slow or inappropriate conversation. That's my main symptoms anyways. I'm moving a little bit into the causes now. So let's see. There's actually a lot more causes than what Google listed, so I'm going to kind of go through them kind of quickly. So this is from a few textbooks. I'm going to list the site down in the description so you can kind of look at what I'm reading. Age-related changes in the CANS function, genetic determinants, so you could just be born with it, neurological disorder, disease, or damage, which is where I fall under, head trauma, cerebrovascular, which is stroke, degenerative diseases, multiple sclerosis, exposure to neurotoxins, heavy metal, organic solvents, so heavy metals I think would be like lead, maybe, I'm not sure with that one, lesions of the central nervous system, so any damage to the central nervous system, and seizure disorders, so what is that disorder called? I can't remember what it's called now. Epileptic. That I think can cause this, from what it's saying. Neuromaturational delay secondary to deafness and auditory deprivation. So this kind of means that your neuro system never matured because you were deaf. So basically you did not have that full experience of hearing sounds, and because you did not have that full experience, you now can't process sound. And it's the same with the auditory deprivation. You never hear sound, you can't process it. I'm not sure with this one, audiological disorder, diseases, or injury. Auditory deprivation secondary to recurrent otitis media. I'm not sure what that is. I know what the other ones are, but I don't know what that one is. Prenatal or neonatal factors, so anoxia or hypoxia, that's too much oxygen or not enough. Cytomegalovirus or CMV. I don't know what that is. Sorry. Hyperbilirubinemia. That is, I'm assuming, high bilirubin in the blood, and it's maybe causing anemia. Not sure. It's a guess right there. Low birth weight, prematurity, and prenatal drug exposure. So if maybe it was like your parents were on drugs when you were in the womb still, I think it's that last one. Treatment. There's no treatments that's actually going to cure it. You can't treat it. There's things that can help, such as direct skills remediation, which is auditory training. Compensatory strategies, recruiting higher order skills to help compensate for the disorder. It's known as a top-down coping skill. Environmental modification, so changing my learning or communication environment. So that means for me, I would have to maybe learn in a quiet space versus being somewhere loud. Let's see. And there's computer-based training as well, so I'm going to put all that down there in the description as well. But it's actually not a super common disorder. Let me look up exactly what the numbers are if I can. So this seems to be only in adults that's giving me this information. So it only affects about 5% of school-age children. So that's fairly small when you think about it. And I'm pretty sure in adults it's probably even rarer. And it is considered a learning disability, so it does cause difficulty learning in adults. They're comparatively rare. So it's less than 5% in adults, which is crazy to think about. Less than 5% of people have it. It's insane when you actually think about it, because there's probably a lot of people that think their hearing's going bad, and it turns out they're just not processing what they're hearing. That's how it was for me. I thought my hearing was going bad. I thought, I'll scoot over a little bit so that light's not bad. I thought that a puncture to this eardrum is what was causing my hearing, and over time it was getting worse. Turns out, no. I have an actual neurological disorder that is a learning disability and will probably prevent me from being able to really go to higher education further than where I'm at. And it'll also heavily restrict what I'm able to do. So my goal originally was to be an RN in the emergency room. I wanted to really get in there and get my hands dirty. But now, because I have to be somewhere quiet in order to actually process sound, that's not going to work. Anybody that's been in an ER knows it's loud, it's busy, anybody that works in an ER, I should say. If you're a patient, you probably don't hear a lot of it, but if you actually work in an ER, there's a lot of nurses talking, a lot of doctors talking, a lot of, you'll hear a lot of computer sounds, a lot of tests being run, a lot of patients coming in and out, a lot of orders, a lot of just everything. There's a lot going on. Phones are a big one too. Our unit secretary, they're answering phones all day, so you'll hear a lot of phones coming through. It's just a lot of sounds, and I'm not going to be able to do that. So that kind of changed for me my main goal with my education. And actually I decided that my main goal should actually probably, I'm actually going to try to focus on mortuary. So I'm going to switch still medical field, but maybe more mortuary. It's quiet, not dealing with a lot of people, and the people you are dealing with are dead, or they're your coworkers, and there's not very many. Most morticians' office only have a couple people in them. Yeah, you gotta deal with, it depends on the victim, but sometimes you have to deal with police, sometimes you have to deal with family, but it's not common. You're not sitting there stuck all the time. And I don't want to deal with, I shouldn't say mortuary, I should say more coroner. I want to work in morgues. I don't want to work in, a funeral home. I don't want to embalm. I don't want to do that. I want to actually be the one taking them apart to figure out maybe what happened. Sorry, there's an ant going around my phone right now. But, yeah. That's kind of what I just wanted to talk about, because maybe a lot of people have it and just don't realize it. Maybe your child has it and you just don't realize it, especially if your child meets those parameters. Maybe they were premature. Maybe they went a very long time without speaking or anything, because that can also be central. That can be deprivation as well. Speaking, you've got to be able to hear. So, maybe it'll help somebody to realize that it's an actual disorder. It's because I've seen a lot of, when I was Googling it and trying to find information on it, I saw a lot of, is it real questions. The answer is yes. It is very much real. It sucks to have. You don't get to understand jokes and sarcasm a lot because you don't process them. You don't understand it. You can't hear that tone. So does it suck? 100%. It is the worst thing that I think I've ever been diagnosed with. And I've got some mental disorders too. So for me, it's devastating. It's like your world just comes crashing down when you know that all of a sudden you are not going to get to do what you really wanted to do. I could do it, but I would be putting a lot of patient safety at risk because I couldn't hear the orders. I may not be able to hear the doctor. I may not understand what the doctor's saying. I may mishear what the doctor's saying. And so, yeah, I could do it. I could totally do it. There's hearing mobility devices. Think of mobility devices, but for hearing. There's stuff like that I could totally get and use. But it's still gonna be a risk to the people that I'm helping, if that makes sense. Because what if I mishear a medication dose? Because sometimes doctors actually tell you to go administer a medication before putting the order in. And that you're not really supposed to, but I know a lot of nurses that do. You may hear, I don't know if you've heard Blippi at all. My son's in there watching Blippi. Sorry if you heard it. But, yeah. So I think that's my main thing. It's just knowing that your entire goals now have to be shifted. And that you can no longer do what you wanted to do. But at least maybe other people understanding and knowing that it is a real thing. People do have it. I have it. The nurse at my ENT actually had it as well. She's somebody that had the same complications. So, it can be done. It's hard, but it can be done. And I think people need to hear that. People who may not know that they have it, that actually have it, need to hear that. It's really important. But I'm going to go ahead and end it here. It's kind of what I wanted to say is that, just talk about this neurological disorder so many people know it is real. But in the meantime, I'll see you in the next one.